Hi, welcome to the Medicare 101 educational workshop. I usually give these workshops in the local county libraries, but with the COVID-19, we don't have that luxury. We do still have people who are turning 65 in the near future, and if you are where I was not too long ago, don't necessarily understand the system. So I did want to put this out there to give you a little vision of Medicare, how it works, and what your options are. Okay, when you sign up for Medicare, the initial enrollment period is generally 7 months. It includes the month that you were born, 3 months before, and 3 months after, which most of you probably are falling into right about now. The general enrollment period, there is a period of time every fall that anyone that would like to, that qualifies, can sign up for Medicare Advantage plans, pharmacy plans. Only during your initial enrollment period are you guaranteed acceptance for both Medicare Advantage, pharmacy, and the Medicare supplements. There are special enrollment periods during the year, such as if you move, if you lose your health coverage through work, if you move into or out of a nursing home, if you qualify for both Medicare and Medicaid. There are periods of time surrounding those events that also open the opportunity to enroll. If you are already collecting Social Security, enrollment is automatic. Your card would arrive in the mail 3 or 4 months before your 65th birthday. If you're not collecting Social Security, about 3 months before your birthday, you should receive something in the mail. You can also call Social Security to schedule an appointment, probably virtual appointment or over the phone these days, or you can sign up at Medicare.gov. With automatic enrollments, it will automatically enroll you in Part A and Part B. If you are still working, you're going to want to contact Social Security and ask them to disenroll you from Part B if you have health coverage at work that you want to keep. It doesn't hurt to have the Part B in place, but you do have the monthly premium you would have to pay. Okay, this is what the Medicare card looks like currently. You'll notice that they no longer use Social Security numbers. That is for your protection. The less that Social Security numbers are out there, the less chance that it'll be abused on the World Wide Web or anywhere else. And if you had only the Part A, which is your hospitalization, that would be the only thing that shows on the card. You'd probably get a card like this in the mail, but if you opted out of Part B, they will send you another one that just shows the hospital coverage. Okay, what is Original Medicare? Original Medicare is just that. It's your Part A and Part B. Part A is your hospital care, and for most people it is premium free when you receive it because we've already paid for it basically. If you've worked for 10 years or 40 quarters, you've paid FICA taxes, and that money has gone to pay the premium basically for the Part A, so you do not have to pay for that when you enroll. Although there is 60 days of coverage in the hospital, covered 100%, and 20 days in a skilled nursing facility, covered 100%. There is a $1,408 deductible per occurrence. This has a 60-day rollover, basically, where if you go in the hospital tomorrow, April 9th, you're there a couple days and you get discharged, you're going to have to pay the $1,408 deductible. If you go back in on May 1st, you should not have to pay it again because that's covered under that 60-day period. If, however, you didn't go back in until September, you would, again, incur the $1,408 deductible. Part B is your outpatient medical services. There is a monthly premium for that. Most people make under $87,000 a year, so their premium is $144.60. I will show you a graph in a moment that does show the higher income levels, and it does incrementally go up. This covers your medical services outside the hospital, doctor visits, lab work, x-rays, ambulance, emergency room, outpatient surgery. Part B is made almost like a group plan, an 80-20 plan, with Medicare paying the 80% and you're paying the 20. The one thing that you need to know is that with original Medicare, there is no ceiling on what you can end up paying. There is a $198 annual deductible with the Part B service. Again, that's why some people, if they are working and have good health insurance through their work, some people opt to delay enrolling in Part B. And again, if you have good coverage through work, then you're not going to be penalized. Okay, as you can see with the Part B premium, $87,000 for an individual or $174,000 for a couple will give you that $144.60 premium. Personally, I would love my income to be up there, so I'd have to pay $300, $400 a month. I would more than be happily pay that premium if I had that income. Okay. Original Medicare does have limitations. Besides not having the ceiling, it does not cover things like dental, vision, prescription drugs, hearing, or help with long-term care. Again, the prescription drugs is something unique that falls under its own insurance category. And as I just told you a minute ago, if you or your spouse are working and you have good coverage through your employee health group plan, you will not be penalized if you delay enrolling in Part B. Okay, now where do you go? The options between group plan, a supplement plan, which we really haven't touched on yet, but we will in a minute, or an Advantage plan. If you have a retiree or union plan, you're going to want to ask these questions. Are there co-pays and deductibles? Does it include a drug plan? A very important question. If I opt out, can I opt back in later? Especially with the Medicare Advantage plans, they give added benefits like the dental, the vision, the hearing. And if you don't have that at your health plan at work, you may want to look into giving at least a trial to an Advantage plan. But if you don't check and you opt out of the plan, will they let you back in? Because if the answer is no, then it may not be worth taking that chance. Cost comparisons, and again, does it include dental and vision? Medicare supplements, or what they call Medigap plans. It fills in the gaps that Medicare does not pay. Again, these are for Medicare approved services. They are, depending on which plan you get, the most comprehensive right now for someone who is aging in 2020 is the Plan G. That covers everything except your deductible. No copays, no coinsurance. It does not include a prescription policy, so you would want to look at that separately. But if you need to budget every month and you have health concerns that you go frequently enough, whether it's to your primary care, to specialists, get frequent testing, these plans can actually manage better because the premium's higher, but you know that that's all you're going to have to pay. Again, if you want to budget medical costs, it may be the best path. If you travel a lot, and there's a good chance you may need to see a doctor away from home. With the supplement plans, you don't need any kind of referrals. You can see any doctor or any specialist. It covers the entire U.S. And it does take care of some of the healthcare costs that Medicare doesn't pay, your deductibles, coinsurance, and co-payments. Those you don't even have to deal with. If you get a Medicare supplement plan during that 7-month open window, It's guaranteed issue, and they cannot cancel it as long as you pay your premiums. Yes, the premiums are higher. Yes, they will likely go up every year. But if you see doctors on a regular enough basis, the deductibles, coinsurance, and copayments do add up. Okay, Medicare Advantage. That is, again, that's what is called the Part C. It actually replaces A and B and puts those services in the hand of a private company. And most of them do include Part D. There are HMOs, which is a health maintenance organization. They have either local networks or regional networks, but that's usually based on the region that you're in. I say it that way because there are different companies that work specifically with one hospital or one medical plan. We would have to sit down and talk about your doctors, see what networks they fall into, and decide if that works for you. If you have a PPO, a preferred provider organization, that you would still have a primary care, but you can go to any specialist in or out of the network, and the original Medicare will take care of the 80%. You'd still have to pay the 20%, but it doesn't, you're not restricted to seeing people only within the network. And whereas original Medicare does not have a ceiling, Medicare Advantage plans do come with a maximum out of pocket. It can be as high as $6,400, but when you weigh that against the possibility of thousands of dollars or hundreds of thousands of dollars, depending on what the health concerns are, it still makes sense for some people. Okay, when is a Medicare Advantage plan the best path? If you need to pay a lower premium. Because they're managing the Part A and the Part B, they can keep the costs down. A lot of the Advantage plans have a zero premium. But again, they do have copays, coinsurance, deductibles. A lot of people who have the VA like to get an Advantage plan to help with things like dental and vision that are not covered under original Medicare. Or if you have a specific network of doctors that you like, that you want to work with. Another reason is if you are on a low income subsidy for Medicare. Part D, again, is your prescription drugs. Each company has its own formulary, and they fall into different tiers depending on whether they're generic drugs, brand name drugs, specialty drugs. The prices can vary by county depending on the plan. Most of the Advantage plans do have the drug plans included. And the thing to keep in mind there is you cannot have an Advantage plan without a drug plan as well as a drug plan. If you're going to have an Advantage plan, you need to have one with the pharmacy in it if you need the pharmacy. Otherwise, if you go in later, let's say you signed up next week for an Advantage plan with no pharmacy, then decided a month or two down the road that you needed the pharmacy. If you put in a pharmacy request at that point, it would cancel your Medicare Advantage plan, so you'd end up just with your original Medicare again. Another thing, again with veterans, a lot of them like the policies without the drug coverage because they can get their meds through the VA. For a lot of people, if you have a low income, there is a low income subsidy that helps with pharmacy. Again, this is just general information for your use. Something most people don't know about, I know I didn't, is what they call a pharmacy gap, otherwise known as a donut hole. When you go to the pharmacy, you pay a certain amount. The insurance company pays a certain amount. The total price of the drug, which is the combination of both of those, the government adds those up. What you're paying is the initial price. When it gets to $4,020, From there to 6,350, you are in the gap or the donut hole. At that point, you're actually going to start paying a higher percentage on your drugs, whether they're generic or brand name. But again, that most of the cost of the drugs, both what you pay and what the insurance company pays, keeps adding up till you get to 6,350. And when if it's expensive drugs in the first place, you're gonna go through that gap probably within a couple of months. And then the remainder of the year, you'd fall under the catastrophic coverage, which is about 5% generally of the retail. And you would have that for the rest of the year from the point that you hit that 6,350. Again, most people don't have that high of a cost of drugs that you would fall into the donut hole, but we do have to make you aware that it exists. Okay, that is our basic information on Medicare. I would love the chance to speak with you, answer any questions that you might have. At this point, you have a general idea of what an Advantage plan does, what a Medicare supplement does. I'm happy to sit down with you. We can do a video chat. We can just talk on the phone. We can do emails. But I would need to know a bit more about you, your lifestyle, your medications that you take, the doctors that you see, and I would be more than happy to help you get to the point that you're comfortable making a decision, making the right decision for what works for you. Thank you again, and I look forward to speaking with you.